The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, craniofacial and plastic surgeon Dr. David Jenikov discusses his detailed and customized approach to rhinoplasty. Minimally invasive spine surgeon Dr. Douglas Wan talks about an innovative surgical technique he developed called Lumini Microinvasive Surgery. ENT Dr. C.T. Wynn relieves his patients' inability to breathe and nasal congestion by diagnosing their deviated septum. Cosmetic dentist Dr. Guy Lewis helps a wounded warrior improve his smile. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Before I had the surgery, I was pretty unhappy with my nose. It had a big bump and it kind of was wider on my face. So I knew I wanted to have it when I was probably hit high school. And so I waited till after I graduated and did it.
So Melanie had a few issues. She had a very broad nose. Both the bone structure as well as the tip were very broad, and the tip of the nose dropped a little bit and was also undefined. So the goal for Melanie's nose was to narrow it, to narrow the tip, to raise the tip, and give her better definition, including straightening the septum internally.
When I initially came to see Dr. Jenikov, he took me in for a consultation and he took photos of the side and the frontal view of my nose, and then he showed me on the computer what it could look like, and I was pretty happy with what he envisioned for it. Dr. Jenikov told me, it was a big decision to make, but he talked me through it, and any questions I had about pain or what it was going to look like, he answered them.
Noses are a little bit different. They require a little bit more time. So when I talk to patients about rhinoplasty, it's important for me to understand what the patient wants. The first thing I do is I sit down and talk to the patient. And I ask them what bothers them. I ask them, kind of what they think they want their nose to look like. Additionally, I ask them if they have any functional problems, breathing problems, if they ever fractured their nose. The other thing that I do, I think, which may be a little bit different, is I do computer imaging after the patient has decided they want an operation. I want to make sure that the patient sees patients of mine, their befores and afters, and kind of sees, that looks like my nose, or that looks like my nose, and I like that result.
Before I got the rhinoplasty, I was definitely self-conscious of my nose, always trying to hide it, and because it was the main focus on my face because it was wider, and after, it's definitely balanced out, and so it made me a lot more self-confident.
Request an appointment on bestdocsnetwork.com.
Eating eggs for breakfast not only tastes good, but they help to slim you down. Each egg you eat has 6 grams of protein, but only 72 calories.
When we started trying to have another baby, weren't successful with that on our own, the old-fashioned way, so we started thinking about other options. And so at that time, I was starting to get a little bit older. Our daughter was getting older. We didn't want too big of an age gap, so we went to see Dr. Kaufman.
Age does impact on chance of getting pregnant, and that's kind of our primary thing, and what we do here is try to size things up with respect to what are your chances of getting pregnant. And the first thing I always look at is age. I try to be kind of sensitive to it. And there is an age-related decline in getting pregnant, even starting in the early 20s, because the deal is women are born with about 1 to 2 million eggs. When they start having periods, they're down to 400,000, and then menopause, you got 0. So what happens, each year women lose about 10,000 eggs a year.
When we first started off with Dr. Kaufman, he recommended, the least invasive procedure We tried that a couple of times and realized that we needed to move on, kind of break out the big guns, and so we did go forward with IVF.
At what age is it getting more difficult? I'd say 37, 38 is it is getting more and more difficult. 40, more difficult, and even at 42, much more difficult. There are always options. So if somebody says, hey, listen, I want a baby, most of the time, patients can have babies. They really can. It just depends on what they're willing to do and what they want to do and what their expectations are.
Dr. Kaufman was really good about explaining that just because one cycle doesn't work, a subsequent cycle isn't necessarily going to go the same way. You could have very different IVF cycles. When we did go through again, it's been about a year and a half ago, we did have a very different cycle and did result in a pregnancy, and in fact our baby girl was born last November. He was so warm and friendly with both my husband and me and our oldest daughter. And I have to say, his wife Lisa, that also works with him, is such a great source of encouragement and such a great resource of information and support for me as well.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com. Find your doctor on bestdocsnetwork.com.
At Lumen Health Spine Care, we developed the latest and the most innovative minimally invasive surgical technique, and it is called Lumini Microinvasive Surgery. This is utilizing the most modern technology so that we can preserve all the normal tissues in your spine without creating any kind of damage to your back and without stripping the muscles. We make extremely small incision and go between the muscle fibers with an endoscope to perform the same procedure as if we perform a traditional open back surgery. The big advantage is that the patients are not going to have significant amount of pain. They're not going to have their muscles stripped off their spine, so therefore it minimizes the bleeding, scarring, pain, so that they could recover so much faster. Patients after undergoing Lumini microinvasive surgery are discharged to home on the same day or the very next day, depending on the type of procedure they're having. And many of the patients can return back to work or their light duty activities pretty immediately after the surgery. So we evaluate the patient to see if they're candidate for Lumini microinvasive surgery by having a full consultation and evaluation, and patient may undergo imaging studies or pain mapping process by our interventional pain specialist so that we can clearly identify and accurately identify their pain generator, and so that we can perform the least invasive procedure for the patient. We developed Lumini microinvasive surgery because I personally witnessed it from my father, who had multiple open back surgery. He went through a significant amount of pain, developed chronic pain, and he had a failed back syndrome and lived 30 years of his life with significant amount of pain. And watching him suffer, I realized that we must do something better than what we're doing now to help all those patients with significant amount of back pain and chronic pain. So we used all the latest technology, worked closely with the engineers to develop the least invasive way to approach the spine.
Amy has a question for Dr. Collins Hodges. At what age should I have my child in for therapy?
Parents are essentially the experts in identifying patterns of behavior in their children. And any significant deviation in patterns of behavior, particularly behavioral patterns, if you're noticing things that are just out of whack, things that just aren't right, all of a sudden you see temper tantrums that are completely off the board, acting out when it isn't usually typical of your child to do so, a lot of withdrawal, child isn't eating, child isn't sleeping enough during the night, child is making unusual statements that are troubling. I would say that there is no right time to bring in your child. I would say that is the time to bring in your child.
Ask our doctors on bestdocsnetwork.com.
My symptoms were like I would always wake up in the middle of the night, having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over, trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aaron is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aaron, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swelling part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose, therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aaron's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes, and Aaron goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe, and now I can. We just appreciate what Dr. Nguyen has done for my life.
A tomato is a superstar in the fruit and veggie categories. Tomatoes contain lycopene, a powerful cancer fighter, and they're rich in vitamin C. The good news is that cooked tomatoes are also nutritious, so use them in pasta, soups, casseroles, and salads.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is, the majority of the time, a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a Ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
Watch more videos on bestdocsnetwork.com.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. Fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, interventional cardiologist Dr. Annie Varghese discusses the signs and symptoms for those with an irregular heartbeat. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions changes his patient's life with a lap band procedure. Clinical psychologist Dr. Collins Hodges talks about the therapeutic techniques he uses to help children and adolescents, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I was quite tired and I travel considerably, and I was at that time I would go through an airport and I'd have to stop and rest, and so I realized that I needed to check in with a doctor and see what was going on.
So Mr. Richardson has cardiomyopathy, ischemic cardiomyopathy from coronary artery disease, multiple blockages that really weakened his heart over time, and that's how I found him many, many years ago, about 15 years ago.
Pretty common that you neglect yourself. You think nothing's ever going to be wrong, but I found out I had high blood pressure and I was border diabetic, and they did a CAT scan, and during that time they found out that I had an irregular heartbeat. So at that time I was told I needed to go to the emergency room, and next thing I knew, I was having a quadruple bypass.
We were able to intervene on his cardiovascular disease, coronaries, fix those, but what happened was the heart was so weak, so he ended up needing a device, which is different than a pacemaker. It's the shock box. A defibrillator is put in under the skin, and again, like the pacemaker, the wires will go to the heart, but then this box is able to protect the patient, shock them, if the heart stops, or if the heart goes into ventricular fibrillation or ventricular tachycardia.
Well, I'm able to carry on my daily work duties, and I can travel, and I'm not so sure if I hadn't had this great care that I would have been able to do that at my age. I'm going on 71 and still working every day, so I give Dr. Varghese lots of credit that she's helped me sustain a good life.
He's been able to function normally, and it has actually improved the function of his heart. He can walk around, he's not short of breath, he can take care of his thousands of employees and customers, and what a blessing that's been for him.
Request an appointment on bestdocsnetwork.com.
When you hurt yourself, should you use heat or should you use ice? Patients often ask me that. Well, here's what I tell people. In the initial phases of an injury, you're going to get swelling. Blood vessels are broken and chemicals and blood leak out, so you want to be on ice at that point. Generally for the first 24 hours, ice at 15-minute intervals on and off. Then take a day and don't do anything. No ice, no heat, and after that, you can start heat. That would be on day 3, maybe do that on day 3 and 4. Heat tends to bring blood into the area. That's why your skin gets red when you put a heating pad on it. The blood comes in, it washes away all the bad stuff, takes chemicals that are good for you and puts them in the injured area and takes away the bad chemicals and gets rid of it. So ice initially, then a 12 to 24-hour period of nothing, and then a couple of days of heat. If you feel muscle spasm and tightness, a heating pad's probably best. Alternating ice and heat at 15-minute intervals can be good for chronic pain.
My life before I came to see Dr. Leon was not very high quality. I had a lot of respiratory issues. I couldn't sleep at night. I couldn't go outside and do some of the things I like to do, like golf or tennis or some of the other activities that I enjoyed. So I needed some help with my quality of life. I'm a pilot with American Airlines, and I have to pass certain medical tests, and having allergies can be a deterrent to passing those medical tests.
We in our practice have been doing rapid desensitization for approximately 20 years. We've done over 4,000 patients. It's a very convenient way for patients to do their allergy injections because they can do a large amount of treatment in a very short period of time. It can be done safely in a physician's office with appropriate pre-medication. And this allows patients to reach monthly injections in 4 to 6 months, not only feel better, but get to their maintenance better.
First, we talked and we counseled a little bit about what were my goals with Dr. Leon, what was I trying to accomplish. And so that was the best thing about Dr. Leon. He really had in mind, what do I want out of the treatment? Not what he's trying to do for me, but what did I want out of the treatment? My quality of life today, after being a patient of Dr. Leon's for over 20 years, is much improved. I can basically do anything I want.
The good thing about allergen immunotherapy is that it modifies the disease, so it's really the closest thing we have to a cure. The recommendations by the American Academy and the American College of Allergy, Asthma, and Immunology are that allergen immunotherapy, allergy shots, be administered in a physician's office.
Dr. Leon spends a lot of time educating himself. He attends conferences, he does a lot of writing, he does a lot of research, he talks to a lot of different patients, he looks at other practices, so his knowledge about allergy care is probably the best in North Texas. My close relationship with Dr. Leon and the type of care he's provided allows me to feel more secure about my future at the airline in terms of my medical certificate and being able to continue flying until I'm ready to retire.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
To avoid your child being poisoned, be sure to store all medicines and household products up, away, and out of sight in a cabinet out of their reach. Poison Control reported 9 out of 10 poisonings in children occur in your home.
I've experienced in my past excessive weight gain. I would diet, lose, gain, lose. I was embarrassed. I was ashamed. I didn't feel good, and the more I gained, the less I felt confidence. I had made the choice that I needed to really make the decision to change my life, to get my health back on track.
Charlotte had a lap band procedure, which is one of the most common procedures that we do. She's been very successful for her. She lost her predicted weight that she wanted to, and the several different medications she took, she doesn't take anymore.
I decided to have the bariatric lap band at My Bariatric Solutions. I have a lot more energy. I strive to do things that I wouldn't have before, experience some exciting things on some of my travels.
A band is put in laparoscopically through small incisions in the skin. We put the band around the top of the stomach, and it's a balloon, essentially. It has a port that goes up under the skin, and we can put salt water in there to tighten the band up. That keeps the food in the top of the stomach and makes people feel not hungry with a small amount of food. It works like a long-term diet, only you feel full with small amounts of food. The most important part of a band patient doing well is frequent follow-ups and getting their band adjusted, especially early on. First 6 months, we will normally do about 5 adjustments until they learn how to use the band. After that, maybe one every 6 months, and then later on, maybe once a year.
My experiences with Dr. Stowers and his staff is so easy. I arrive, I'm seen in a timely manner, in a professional manner, and people are so friendly and they treat me as a family. Each time is very special, and I look forward to seeing the doctor. He's very friendly, very cordial, and very professional all at the same time.
Sarah has a question for Dr. Paul Chung. What is a rotator cuff?
It's a set of tendons and muscles that run around the shoulder and help hold the ball in the socket. Its purpose is to keep those two components together so that you can lift your arm. So if your rotator cuff isn't working, then you're going to have trouble with moving your shoulder, especially moving it up. People who have rotator cuff problems often have pain on the outside of their shoulder, and they often have pain at night that especially even wakes them up. Certainly trouble sleeping on it at night or rolling over on that side, and some weakness. And so all these things are really common complaints of people who have rotator cuff pain.
Ask our doctors on bestdocsnetwork.com.
I think people get the differences between a psychiatrist, a psychologist, and a counselor confused. So here are some of the major differences. A psychiatrist is a medical doctor. For the most part, their practices deal essentially with prescribing and then monitoring medications. Counselors have a master's degree in psychology or a related field. Psychologists have a doctorate in psychology. So my doctorate is in clinical psychology. I've had 8 years of training in both the assessment and intervention of children and adolescents, with a specialty in the emotional and behavioral problems that they present when they come in. You distinguish adolescent therapy from adult therapy in large part on what the developmental differences are, what the developmental task is for that age group, and that is, who am I? How do I fit into this world? When parents are debating whether or not to bring their kids in for therapy, the first piece of advice that I have for them is to sit down and spend some time talking with their child about what therapy means to them. My first session is always a consultation that doesn't cost anything, and so I want to use that time to really get across what it is that I do, but really, more importantly, to get an idea of how the child perceives his or her problems and what it is he or her wants out of treatment. What are his or her goals? I think it's really important to help adolescents understand who it is that they are and how best to fit in with other people. That's what makes those crazy years from 12 to 19 or 12 to 20 so critical. And so if I can help them get a greater understanding of that, developmentally speaking, then I'm doing my job.
Watch more videos on bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.